It is recommended that these fees and costs are provided to parents in writing in advance of the process, and that you let parents know what you will be, what fees there will be. What do you charge for? Do you charge for reviewing emails? Do you charge for telephone calls? Do you charge for talking to the child's therapist? Do you charge for talking to the child's teacher or the coach or the music teacher? All of these things need to be clarified with the parents in advance. The most common scheme is where parenting coordinators charge for all services and charge on a billable hour, similar to how most attorneys bill, where there is for every 5 minutes, 1 minute, 10 minutes you spend, the family is charged, and this comes from a retainer, so that the services that are being provided are very clearly detailed, and families know in advance what they're being charged for. There should be clear financial records. This is spelled out in the guideline as well, so that if at any point in time a family wants to know why, my invoice, what is my account, I can provide a copy of what I did and why. So communication and record keeping. Do you need me to stop? Okay. So the communication protocol that is established, generally in the beginning, the parenting coordinator is the one who is determining how the parents will communicate in the beginning. This is because they're in high conflict. If they were able to communicate effectively and make decisions, communication and confidentiality that I referred to earlier as liminal with the support team or extended family members should be clarified in the beginning. For example, if I'm working with a family and one parent has remarried or they have a new romantic partner, will I be having access to that person, talking with that person? Will I be bringing that person into the process? That's a decision, generally, I, as the parenting coordinator, will be making. But I let parents know in advance. If there's documentary information that I need, records that are relevant, child's medical records, academic records, mental health records, then I will let the parents know in advance. I will be acquiring this information. I will be reading this information. I'll be reviewing this information. So that the families, that's a part of the initial informed consent, helping families understand what this process is. Because it's different. It's very different than family mediation or custody evaluations or other types of certainly very different than therapy. It's a very different kind of process. So I have to let them know what's different here. I also let them know if there's going to be any ex parte communication, meaning communication with the court or their lawyer. We have a record of agreements and a record of decisions. So, as I mentioned, temporarily incarcerated. He was arrested and he ended up being in jail for a period of time. It was a short period of time, like 4 months. And so the process had to be temporarily interrupted until he was out of jail and able to participate again. So there's now a guideline that talks about how to interrupt the process. It does not mean the parenting coordination process stops, because if there's a temporary incapacity, like in my example of the mother with a mental illness or the father who was incarcerated, we knew that was just going to be for a short period of time, and the family was still going to need services. They were still going to need help after that incapacity or impairment was resolved. If there's substance misuse or abuse, that's another example where a parent may be temporarily incapacitated. The parenting coordinator is obligated to do a screening to determine if substance misuse is occurring regularly and impairing that parent's ability to safely parent when they have the children, when they are the on-duty parent with the child. So the parenting coordinator screens for not just substance use, but it's substance misuse. Misuse is the new term. It's used in terms of abuse or dependence because it does not require now that a parent be diagnosed as an alcoholic or a drug addict, for example. You can be impaired and be a not safe parent well before you are diagnosed with that condition. So that's why the term changed, so that it didn't require a diagnosis of a drug addiction or an alcohol addiction, for example. And so the parenting coordinator screens for substance misuse and any mental impairment. Often the parenting coordinator may require treatment for the misuse, or if a parent can be rehabilitated and is willing to be rehabilitated, to get treatment, to help them be a safe and effective co-parent. So the parenting coordinator is often the one making the referral, helping the parents get to the services they need in order to serve in a safe capacity that's there. There's a new guideline about technology because this has become an increasingly common means of providing parenting coordination services. These guidelines specifically talk about the type of technology, how to utilize sort of secure Wi-Fi or encrypted, if you're sharing files, how to do encrypted files, with a VPN, not using any software programs or access to the internet that does not have safety and capacities, safety and security for the families and any records that would be shared or would be stored. This is certainly true if you need to dispose of records. You don't throw them in the garbage can, you have to shred them and so forth. So all that security and confidentiality and technology has a new guideline that's spelled out there. If you are going to be using technology as a part of the process, the family should be informed in advance how you will be using this. So, for example, I regularly use Zoom it's a web platform for virtual meetings. I require families to have either a computer or like a smartphone that has access to internet and a camera and a microphone. They have to be at a safe place for the meeting. They can't be in the public square, or they have to be in an office. All of those things are specified. If I'm going to be sharing files, I let them know how I'm going to be sharing their files. I have a static, IP, or I have a virtual VPN for sharing of information, so it's a secure way of showing them records and so forth. But I let them know in advance what I'm going to be using, what is required of them, how it's used, when we will be meeting. So more often than not, when I'm starting a case, I require the families to meet in person so that I can explain all of this. They can sign all the forms that I need, all the documents. I've gathered information. But often after that, I may not be meeting with them in person on a regular basis. Many of my appointments may be virtual appointments. So, for example, I've been in Europe now for about a month, and when I was the earlier part of this month, one of my parenting coordination families had a crisis. And so I could set up, it didn't matter where I was in the world other than time zone and me being sleepy, an appointment to address the need of my family.